Welcome to your CEO briefing. Today I want to talk about disruption in healthcare. In fact, I'd like to characterize it as a period of hyper disruption. And what does that mean and why is that happening? Because I think it's really important for us to understand what are those macro trends that are impacting healthcare and how they're going to impact you and me and the rest of the profession. So I want to throw some numbers out and discuss how those numbers are impacting all of us. So I'll start with the number 18%. Currently, today, this country is spending 18% of its gross domestic product in healthcare, which is staggering, a staggering number. And then when you consider the fact that that number is going to be well over 20% by 2025, it paints a pretty ominous picture in terms of how healthcare spending is going in this country. Today, right now, we're spending $4 trillion a year on healthcare, $4 trillion. And that's about $11,000 per person. And those numbers are going up precipitously. You confound that with the fact that we are spending right now, or we have a national debt right now of $24 trillion. So it paints this picture of economic uncertainty and downward economic pressure on providers and facilities that provide healthcare. And then you start talking about what is the impact on those facilities. So right now, there are 1,800 rural hospitals in this country, of which well over 40% are in the red. They're losing money every year. There are over 400 of these hospitals that are at significant risk of closure in the near term. And since 2010, we've had over 120 hospital closures in this country. So significant impact, obviously, on what's going on in healthcare. And we know that CRNAs are the predominant anesthesia providers in these facilities. And you look at what the demands are going to be now and in the future, and consider the fact by 2025, we're going to have over 110 million Americans over the age of 60. So that's going to result in a massive amount of increased healthcare demand and a mass exodus of providers out of the workforce. So those are all pretty ominous statistics. Having said that, it's creating this environment of hyper disruption. And what we can see at Washington, D.C. with our federal advocacy, and certainly at the state level, is a significant amount of opportunity for CRNAs to be involved in removing barriers for the use of CRNAs. I'll give you an example. Right now, as of today, we have 20 state associations proactively pursuing the removal of barriers for the use of CRNAs in this country. And we don't have the time, obviously, to go through each state and each issue, but the amount of momentum that is being built is profound, profound. I'll give you an example, a couple examples. I was in South Carolina a few weeks ago, and I was honored to be asked to provide testimony in the removal of physician supervision bill. And it's been a while since I provided testimony, so it was a great experience for me to be involved in that again and to see just the amazing work that they're doing there. And then not long after that, I spoke at the Florida Association meeting. And I didn't realize this until I went down there, but every Tuesday and every Wednesday during the legislative session, CRNAs and other advanced practice nurses are in Tallahassee in the Capitol wearing white coats, telling the story of who we are and what we do. And they are making major strides in both of those states. Now, whether they're ultimately successful this year or not, I think it's too early to tell, but the amount of progress they've made in that short period of time is a direct result of the hard work that they're putting in and also the support that we're providing them here at the AANA. So just from a high level, if you're noticing the activity, you feel like there's a lot going on, let me validate for you, there is a lot going on at both the state and the national level. So segue. If you have not been to mid-year assembly, you're missing out. Mid-year assembly is, I know this would be controversial, but I think it's my favorite meeting. There is just so much going on, so much energy. And if you haven't, you should go. If you plan on going, I would recommend that you book your hotel and your registration pretty soon, because the numbers are really high. So which is great. So our tagline this year is be this voice of the CRNA, and there's never been a better year to be the voice of the CRNA. So I look forward to talking to you in person or virtually, and some of you I'll see you soon at mid-year assembly and other meetings. And if there's anything you want me to talk about, you have any questions, please feel free to post them in the comment section of whatever social media platform that we're using here or that you're viewing this. So Have a great day. Thanks.